Bismillah ar-Rahman ar-Rahim. In this lecture, I will talk about thyroglossal duct cysts. Thyroglossal duct cysts are the most common congenital cervical anomaly. Thyroglossal duct cysts can form anywhere along the thyroid throat of migration between the tongue and the inferior neck. We are seeing here migration tract of the thyroid gland. We are seeing here in this slide foramen cecum, epiglottis, hyoid bone, larynx, cricoid cartilage, and thyroid gland. And we are seeing here foramen cecum, hyoid bone, thyroglossal duct cyst, thyroid cartilage, and thyroid gland. Thyroglossal duct cysts often present as midline neck cysts closely associated with the hyoid bone. This activity reviews the evaluation and management of thyroglossal duct cysts and highlights the role of interprofessional team members in collaborating to provide well-coordinated care and enhance outcome for affected patients. Thyroglossal duct cysts are the most frequently occurring congenital cervical anomalies, with 7% of the United States population typically measuring 2 centimeters around. We are seeing here in this slide potential locations of thyroglossal duct cysts and ectopic thyroid tissue. The first location is in foramen cecum. The second location of thyroglossal duct cysts is suprahyoid bone. The third location of the thyroglossal duct cysts behind the hyoid bone. The fourth location of the thyroglossal duct cysts is infrahyoid bone. Thyroglossal duct cysts can affect children and adults, but most cysts are found in children aged 10 years and younger. These cysts are almost always benign. Less than 1% of all thyroglossal duct cysts become cancerous. Adults are more likely than children to develop thyroglossal duct cyst cancer. Thyroglossal duct cysts are treated with surgery. Once removed, most thyroglossal duct cysts don't come back. Epidemiology of the thyroglossal duct cysts are present in about 7% of the population worldwide. They have an equal preponderance between male and female individuals, although they are known to be the most common pediatric mass. They also present in adults with varying frequency. These types of the cysts are closely associated with the hyoid bone. They are about between 20 to 25% present at the level of suprahyoid bone, between 15 and 20% present at the level of the hyoid bone, and between 25 and 65% present at the level of the infrahyoid bone, as we seen in this slide. The question now, how serious is a thyroglossal duct cysts? Most thyroglossal duct cysts don't cause serious medical problems. There are exceptions, though, including very rarely cysts become cancerous. Some cysts cause dysphagia, this meaning problems swallowing food or liquid. Cysts can become infected. An infected cyst can hurt. The question now, can a thyroglossal duct cyst go away on its own? The answer, no. Thyroglossal duct cysts remain in place until they are removed with surgery. I will talk now about symptoms of thyroglossal duct cysts. If you or your child has a thyroglossal duct cyst, you may first notice the cyst because there is a lump on you or your child's throat that moves up when you or your child swallows. You also may spot a cyst when you or your child sticks out their tongue. Sometimes healthcare providers discover these cysts while doing a physical examination for another reason. We are seeing here a case of thyroglossal duct cyst in a 7-year-old boy. And we are seeing here a thyroglossal duct cyst occurring with protrusion of the tongue. Other symptoms of thyroglossal duct cysts include thyroglossal duct cysts can be felt through your skin. If you touch the cyst, it may feel soft, smooth, and round, like a tiny ball of cookie dough. These cysts can swell and hurt if you or your child develops an upper respiratory tract infection that spreads to the cysts. I will follow the symptoms of thyroglossal duct cysts. Thyroglossal duct cysts can rupture, oozing fluid through you or your child's skin. These cysts can make it hard to swallow food or liquids. I will talk now about causes of thyroglossal duct cysts. These cysts develop during gestation when your body begins building your thyroid gland. To build the gland, thyroid cells travel from the base of your tongue to your hyoid bone and finally reaches to the thyroid gland place. Thyroid cells make that journey through what's called the thyroglossal tract. This journey called the thyroglossal tract. Typically, this tract closes off and dissolves once your thyroid glands are in place. But the tracts that don't close off can fill up fluid and mucus and become thyroglossal duct cyst. Researchers don't know why some people's tracts don't dissolve. I will talk now about diagnosis of thyroglossal duct cysts. We will begin with physical examination and requested imaging study. This consists of ultrasound, CT scan, MRI scan. I will talk now about the treatment of thyroglossal duct cysts. The treatment for a thyroglossal duct cyst is surgical removal, as we seen in these slides. Surgical treatment requires not only the removal of the cyst, but also its potential connection to the base of the tongue in order to prevent recurrence. This includes removal of the central portion of the hyoid bone, since this connection can be anterior or in front of or posterior in back of, or actually within the bone itself. This operation is called a cyst-ring procedure. The recurrence rate can be up to 50% if the central portion of the hyoid bone is not removed. In the end of this lecture, thank you for all.